This, I would point out, is the CSEP CNS Symposium. Each conference, we try to bring together both exercise and nutrition, and it's also sponsored by the publisher of APNM. And the topic this year is on sex differences in lipid metabolism, and with the emphasis of bringing in various tissues and not just exercise, or not just muscle or adipose tissue. And for my own talk, I'd like to acknowledge not only our sponsors and the people, the agencies that supported my work before I retired, and my many collaborators. And I would point out to you the statement that Bengt Saltine gave long ago in terms of the goal is to understand and not only describe basic phenomena. And too often we describe things time and again and almost don't try or think to try and understand what's going on. I can't give you an understanding today, but I'll do my best to get you thinking about it at least. Why the topic of sex differences? It requires integrated physiology, to remind everyone that metabolism doesn't just occur in muscle, and that exercise doesn't just involve muscle. Nutrition and exercise metabolism are intimately associated, and for the exercise physiologists in the room, that nutrition doesn't mean that you bring your subjects in fasted, and even if you did something like carbohydrate loading, well, there's 1,000 different combinations of carbohydrates. They're not all the same. And if it's a high carbohydrate diet, chances are it's low in something else, such as fat. In terms of the topic of sex, it's ignored. It's highly important. And Vern was pointing out to me that CIHR have a special competition now in terms of using sex as a variable in biological phenomena. So in terms of my topic of postprandial metabolism, I could not find a definition of it anywhere, and I finally contacted a dominant researcher at the time, Adrienne Hardman, and she said that she couldn't find one either, and she'd been working in the field for over 20 years, and offered this, and I think it sums it up. A time when the metabolic priority is storage rather than production, hormonal and cardiovascular responses to digestion and absorption of food are the dominant features. So why postprandial? Well, we spend about 18 hours a day in this state because we probably consume at least 4 meals a day. Rarely does our body see that metabolic state of 12 hours of fasting that our physician has us in when they assess our health, or as physiologists, we have our subjects in when we begin our experiment. And then add to this exercise, sex differences, biological age, whether you're adolescent, at young adult, aging, and what tissues are involved. And you can see you get into a very complex aspect. I hope to fairly quickly do some describing, and then I'll try to understand. So I used this study, even though it has very little to do with today's topic, because it really emphasizes the interaction of eating and exercise, even though it was done some time ago. In an 8-hour period, they had subjects either eat a meal, as described there, and then perform exercise and remain in the calorimeter for 8 hours total, or do the opposite, exercise and then eat. And the exercise was very mild, 3 to 4 METs, 5 kilometers an hour at a slope. And the two treatments are, of course, calorically identical. The exercise is very mild, so there won't be depletion of muscle glycogen and so on. And what they found is if they exercised and then consumed the meal, over the entire 8 hours, there was 17% less carbohydrate and 52% more fat oxidation. And the storage of carbohydrate increased and fat decreased. So this highlights even a very mild exercise and one meal can alter entirely how the body is responding metabolically. And clearly other tissues have to be involved. Why would we look at lipids? Well, postprandially, lipid metabolism goes on for at least 6 to 8 hours. And this rise in serum triglycerides is a known risk factor for cardiovascular health. If your triglyceride level is greater than 1.7 millimole, for every 0.1 millimole level above that is an increased risk, especially in women, for cardiovascular disease. 2.3 is the definition for clinical hypertriglyceridemia. And both elevated fasting or postprandial triglycerides are an early reflection of cardiovascular risk. So, in terms of lipid metabolism, we have both dietary chylomicrons and VLDL. Fortunately, they have different proteins associated with them. So one way of discriminating in a blood sample is to look at ApoB versus ApoB100. And one of the first surprises that I encountered was that in a postprandial metabolism state, that not only chylomicrons are going up, but also VLDL. And in fact, although other people have shown this is an excellent study in 2011 that demonstrated that, in fact, much of that prolonged rise in triglycerides that I'll show you in a minute is the product of VLDL triglyceride, which is liver metabolism. So the concept that we'll be using quite a bit in today's presentation is an oral fat tolerance test, which was really pioneered by Adrian Hartman. And basically, you go to the grocery store, buy a bunch of foods that are high in fat, and give them to the person on a per kilo basis, and then follow triglycerides for a prolonged period of time. The problem with that is, of course, the person's not only ingesting fat. And even during this postprandial period, you can actually measure a stiffening of the arterial wall. Here's an example from Hardman, and you can see these were postmenopausal women who were in very good health, very low triglycerides, and after the fat meal, you can see this large, slow rise. But then she went further, and she had them do walking exercise the day before, then have dinner and come in and have the fat challenge. And what she found was a marked suppression from one bout of mild exercise the day before the fat challenge. It wasn't due to an energy restriction, because if she simply restricted calories, she got the same result. So it was an exercise factor. And the arrows over here indicate, though, anything above this level of 1.7, you're at greater risk, and this is clinical hypertriglyceridemia. Whoops, sorry. And I would point out that unlike an oral glucose tolerance test, 6 hours after this, the triglycerides are still elevated. So, among other things, you have to be very patient as a researcher. So, and that's one simple meal. How often do we go 6 hours without eating? So, while this is occurring, we're ingesting another meal. And I put up these arrows as a personal note. Last November, my beautiful, wonderful wife was diagnosed as a type 2 diabetic. And within the analysis, her triglycerides were up here at about 2.8. The incredibly knowledgeable physician, when I asked about her concern with the triglycerides, said, "Oh, we don't look at those anymore." Fortunately, my wife consulted an exercise physiologist, a rather older one, and began to exercise every day. And within a few months, not only was her hemoglobin 1AC now below a type 2 diabetic level, but her triglycerides had fallen from there to here, even though we don't worry about those anymore. Hardman asked the question of whether this was exercise training in terms of the response or a single bout of exercise, and this was the control situation, and this was if you had the women exercise the day before, and then she had them do no exercise for 5 days. These were trained women, and you see that you very quickly lose the benefit. So one exercise is beneficial, but you're only as good as your last bout of exercise, rather like increased insulin sensitivity. And in terms of sex differences, Hardman always worked with a female population. This is from Jeff Horowitz, one of the many studies that have compared men and women. This is the female response to a triglyceride challenge versus the male. And I think you don't need much convincing to see that there's a very marked sex difference. And they also had a label in the triglyceride and were able to monitor fat oxidation, and there were no sex differences. So that difference in triglyceride rise wasn't due to oxidation. So to try and speed things up a little bit here, just to then use some reviews, Henderson's review in Frontiers of Endocrinology in 2014 demonstrated very clearly that men have greater post-exercise fat oxidation, but if you give them a meal post-exercise, you don't see the sexual dimorphism. And another review in JAP by Fries did a meta-analysis looking at the impact of exercise followed by an oral fat tolerance test. The average benefit was a decrease in triglyceride area of about 24%, and it was greater in women. And they included a whole spectrum of other parameters that could influence it and concluded that the sex differences was the most powerful moderator of the response. So if we then leave describing and start to try and look a little bit in understanding, Mark Decker, who was a grad student in our department, was able to work with food scientists to develop a pure oral fat tolerance test, liquid. And the really interesting thing is they could also change the P-DES ratio in the fats, so you could study different fats. In his first study, he recruited mature men, about 60 years old, and some of them, half of them were below a threshold for cardiovascular risk in terms of triglycerides, and the other half were above that level. He then gave them various oral fat tolerance tests, and although the results were the same for regardless of the P-DES ratio, this is just the average, and you can see that the men that start out with a low triglyceride level have a much dampened response, and those that come in with very high levels, in fact, have a larger response for a longer period of time and a greater acceleration in the response. And to put it in perspective, I wish we had taken a photograph of it. In one trial, Mark came to me and said, "Do you think this has a lot of triglyceride in it?" Held up the tube of blood, and it looked like you had put a cup of cream in with the plasma. It was unbelievable how white it looked. Whoops. So now, in the last 8 hours, have you had anything to eat since breakfast? So if you have, you've perhaps here, or here, or here, or all of those places, you've added to this challenge. So he then went on and took men who had a high fasting triglyceride level and had them either not exercise or exercise the day before, and then gave them an oral fat tolerance test. And what he found first is that even before they exercised, their lipid levels had dropped, and this was due to VLDL decrease. And there was also a 17% reduction in the area under the curve in response. And interestingly, the beta-hydroxybutyrate levels in the post-exercise trial were elevated, suggesting that the liver metabolism was involved. So up to now, then, we see that assimilation of lipids is important to one's health. Single bouts of mild to moderate exercise prior to the meal alters this assimilation. Exercise prior to the consumption of lipids lessens the chylomicron and especially the VLDL triglyceride level. And there's a decrease in whole body lipid storage, and there are sex differences. So let's then take a look at what tissue it could be. It's highly unlikely it's muscle. There's no training effect. It's only lasts for about 2 days after the exercise. It's not due to changes in muscle lipid or carbohydrate. And you can even eat a meal after the exercise and then have the fat challenge the next day. In addition, Hardman's lab did 2 other assessments. One was to give a Sipamox, which inhibits fat mobilization, and so you change muscle metabolism during that exercise, and it didn't do anything in terms of the oral fat tolerance test. And they actually, in another study, measured directly with direct FIC the leg triglyceride uptake, and there was no effect on the leg. So it wasn't the previously active leg that was doing the work. It's unlikely that adipose tissue was a factor, since it wouldn't be affected by such mild exercise, and this is taking place up to 24 hours later. So what's left? The gut and the liver. Hardman's lab again gave us guidance here in that if they gave the fat challenge intravenously, they saw no effect of prior exercise, suggesting that the gut in some fashion had to play a role. Several studies, including our own, showed that beta-hydroxybutyrate was elevated if you had exercised before the fat challenge, so implying perhaps increased liver fat oxidation, and there is evidence that I'll get to in a minute of less production of VLDL. And we also have the question of visceral adipose tissue. So exercise isn't just muscle. So let's leave exercise and get back to the question of sex differences. Oh, that must be love, not sex. And this is an amazing study by Tracy Horton, who took men and women, and I'll just talk about the trials where the people came in fasted. They catheterized femoral artery and vein and measured leg blood flow as well as leg AV differences for uptake. Then they fed them a meal with a tracer in the triglycerides and followed them for hours. And they took biopsies of the leg muscle and leg adipose tissue to look at where the tracer was going. And what they found was sex differences, first of all, on the triglycerides. And what that means as well is an enormous difference in the delivery of triglycerides to the leg. A fourfold difference between the men and women, with women being much lower. No differences in the carbohydrate side. So differences exist in triglyceride metabolism and not fat metabolism. Sorry, not carbohydrate metabolism. So is it clearance or is it VLDL production that's the difference? Well, in terms of leg uptake, the women, despite the fact that delivery of triglycerides was only 25% of what it was for men, had a threefold greater leg uptake of triglycerides. Now, the complicating factors is we don't all have the same size of leg. And even if we did, we have different amounts of adipose tissue and muscle, and the quality of it could be different. So let's look at their tracers. And what they found was, and we'll just do the left-hand side of the screen, is that the female muscle took up twice as much tracer than the male muscle. The muscle. We tend to think of sex differences in terms of adiposity, but in terms of the fat, the amount of tracer taken up was the same. Crazy. Who'd have thunk it? But then we also have quantity of tissue. The female leg will have less mass total, less muscle, and more adipose tissue. So we have to be very careful in the interpretation. In terms of the consumed fat, the female leg cleared more triglyceride and more label. The female leg took up about 40% more if it was even normalized per kilo lean mass, because they determined how much muscle mass there was. The females experienced much lower triglycerides and a much lower delivery. Now, unfortunately, they did not measure the amount of adipose tissue in the leg, but the mass of the leg, or rather the muscle mass of the leg, was very similar to what Jensen has reported numerous times in his work at the Mayo Clinic. So what I did then was to take data from his work in terms of, in all likelihood, how much adipose tissue was in the leg of these men and women. I then took the amount of tracer per gram of tissue in the men and women for muscle and for fat. And there was a much greater uptake in the muscle in women and the fat was about the same. But then when you allow for how much muscle was in the leg, you can come up with a total amount of tracer that would have been taken up, and this large difference almost disappears, and in fact it was non-significant. And if you move to the adipose side, you see that although there was no difference in the quality, because of the difference in quantity of adipose tissue, I say it is a question mark because this is all my extrapolation. I don't know if statistically this increase was significant, but I suspect it was. Whoops. So in terms of the total, you still see that the women were clearing more of the tracer than the men, and it was due to both the amount of tissue and the quality of the tissue in terms of the muscle. So if we come back to this, what about the men? What are they doing? Well, we know that men on average would have much greater visceral adipose tissue, but what about VLDL production? Well, yesterday, Michaela, who's one of our speakers, passed on a paper to me demonstrating that in an oral fat tolerance test that the women show less rise in triglyceride, which we know, and a greater liver oxidation of fat and less de novo VLDL synthesis. So there are definitely gender differences, sex differences at that level. So to summarize, single bouts of mild to moderate exercise after alter the postprandial assimilation of foods Exercise prior to the consumption of the lipids reduces the accumulation of triglycerides by 20 to 30% for at least 6 to 8 hours. The effect is not mediated exclusively by the previously exercised muscle, and it may be that visceral fat and/or liver are major contributors. There's increased oxidation of the adipose tissue and decreased VLDL production. In terms of sex differences, there are many. The women have a lower postprandial triglyceride rise, greater leg clearance of triglycerides, and this is due to the quality of the muscle and the quantity of the adipose tissue in the leg. Men deposit more of the triglyceride in their upper body and have more VLDL synthesis, so production and clearance are both factors. Diet and exercise profoundly interact, and they're involving many tissues, even in a single day. So, thank you. I'm not sure how much time we have. Do I have time for a few questions? Okay. So, there is a mic at the back of the room as well, if anyone has questions. You have to make me feel good and ask at least one.
Okay, so you focused on triglyceride-rich lipoproteins, but I was wondering if you could comment on cholesterol and sex differences in HDL levels, and that might be apparent, and maybe also kind of bring into that whether there are any sex differences in sex hormone synthesis in response to exercise.
What was the very last part of the question?
Any differences in sex hormone synthesis that may be a consequence of that exercise effects on lipoprotein metabolism?
Well, I can answer the first part easily. I have no idea. But in terms of the hormonal aspects, it hasn't been examined very closely at all. But it appears that there aren't differences that are, if you want to call it transient, over a few days of follicular versus luteal in terms of the triglyceride response. However, there has been at least a couple of papers showing that women who are taking oral contraceptives have an impaired triglyceride response compared to the non-contraceptive user. And the other aspects are, and you can see how complicated this gets, is if you test women premenopausal and postmenopausal, the postmenopausal women have almost a male-like response in terms of the triglyceride response. So it appears that the long-term impact of estrogens probably are a factor. I've only found one study that looked at the other end, and that is adolescence. And it appears that as you move from adolescence to young adulthood of 19 or 20, there's a progressive improvement, if you want, in the young girl woman's ability to process triglycerides, where the male response tends to do the opposite. So it appears that over a prolonged exposure of these very important hormones, that there are factors, but not in the short term.